Thank you for joining me for our last of 4 parts about Medicare. Tonight should go fairly quickly, so we'll try and get you guys out of here fairly early. But as always, please don't hesitate to ask questions if you have them, either in person or by chat. Hopefully everybody got the email that I sent out earlier this afternoon with the handouts and the slides so that you can follow along. And as always, you're always welcome to reach out if there are any questions after we are done with all of these sessions. So we'll go ahead and get started. Tonight we're going to talk about all other kinds of insurance that might be available for options to go with your Medicare when you become enrolled in Medicare. So other health insurance options. As always, we're going to do a quick recap of what we are, who we are, and what we've already covered. As always, we are part of the Area Agency on Aging that covers El Paso, Park, and Teller counties. The purpose of this Area Agency on Aging is to work with our partner communities to develop programs and systems that help people stay in their homes and in the community for as long as possible. Again, I am the coordinator for the local SHIP program, State Health Insurance Assistance Program. This office covers 9 counties in Colorado, and we can help you with any and all possible aspects or anything related to Medicare. This is a federal nationwide program. Every county and every state does have access to this program for assistance and advocacy in Medicare. Brief recap of what we've covered so far. We've covered Medicare Part A and B, also known as Original Medicare, the coverage, the cost, how to enroll. Then we covered the primary options for coverage to go with your Original Medicare, Medicare Advantage plans, and Medigap, also known as Medicare supplements. And then last week we covered the newest benefit of Medicare, Medicare Part D. D stands for drugs, and how that works, what it costs, and how best to find the appropriate Part D coverage. And tonight we're going to talk about pretty much any other option that might be out there, including active employer coverage and COBRA, retiree coverage if you're military or retired military, Medicaid, and Marketplace. And if there are any of those options or any options that I have missed, please feel free to speak up. So we're going to start with active employer coverage. I mentioned during our first session that being actively employed and having employer group health insurance through that employment that covers either you and or your spouse is basically the only excuse Social Security will accept for delayed enrollment into Medicare. So if you're actively employed, you're covered by employer health benefits, you become eligible for Medicare, you turn 65, you can delay enrollment without penalty for as long as you are actively employed and covered by that employer health benefit. And that covers also your dependent spouse. So employer group coverage is automatically considered creditable for both Medicare and drug coverage purposes as long as you are actively working. And there are no penalties if you delay enrollment into Medicare based on that active employment. The other thing to know is that employers cannot require that you enroll in Medicare if you are going to continue to work and continue to have that employer coverage. You become eligible for Medicare. That Medicare eligibility cannot affect your employer health benefits at all, as long as your employment doesn't change. And they cannot require that you enroll in Medicare so that you drop off the employer coverage, and they cannot offer to pay for you to enroll in Medicare as an incentive to drop off the employer group coverage. Both of those things are illegal for them to do. And although it is a nice thought for them to want to do that, they're not allowed to do that. They are required to continue you on the employer coverage as if Medicare never came up. Co-coverage is COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. This is basically continuation coverage. This coverage comes in handy particularly for people who are or who have chosen to stop working or are no longer employed. And there's that little bit of window between end of employment and employer coverage and Medicare enrollment and eligibility. COBRA coverage is designed to be temporary, but it would continue whatever employer coverage you had or you were actively employed and then stopped working. It continues that employer coverage for up to 18 months on average. There are scenarios where it can be extended to 36 months, and there are some situations where if the spouse is covered under the COBRA, they can be extended. But it is, again, designed to be temporary. It is not considered creditable coverage, and you really don't want to have COBRA and Medicare at the same time if you can help it. So COBRA, it's a good stopgap. It's a good temporary coverage to get you through until Medicare eligibility kicks in, but it's designed to be temporary, and it can cover your dependents and your spouse. So when you become eligible for Medicare, depending on when that eligibility and enrollment happens, so if you become entitled to Medicare while you're actively employed, you delay enrollment into Medicare, then that employment ends suddenly, and for some reason you elect to get COBRA. And typically that's going to be because the spouse isn't eligible for Medicare, but they need to have continued health care. Or you have dependents that need to continue having health care. You can enroll in COBRA if you're entitled to Medicare prior to the end of employment. But you want to keep in mind that COBRA is always going to be secondary to Medicare. So you're going to be paying for two insurances that you don't necessarily need. And COBRA does tend to be much, much more expensive because basically that continued employer coverage, what happens is you start paying the full premium versus what was hopefully the smaller premium that you paid while you were employed because the employer paid the greater part of that monthly premium. If you become entitled to COBRA or entitled to Medicare after you've been on COBRA, so say you were working, employment ended, you took COBRA to have coverage, and then 6 months later you became eligible and enrolled in Medicare. In that scenario, you would absolutely not want to stay on the COBRA because whether you choose to take Medicare at that time or not, and there are some people who would prefer for some reason to stay on the COBRA versus enrolling in Medicare. The downside to that is regardless of whether or not you enroll in Medicare, COBRA is going to assume that you did. And they're only ever going to pay as secondary to Medicare. So if you don't enroll in Medicare, you keep the COBRA. From that point forward, from the time you became eligible for Medicare, even if you didn't enroll, COBRA is only going to start paying the 20% that Medicare would have left over. And that can cause some financial hardship for people who don't realize that. And I have seen it happen, unfortunately, too many times. So the bottom line is, and the best rule of thumb is COBRA and Medicare do not mix. They do not really work well together. And it's not really to most people's advantage to stay with both. Now, again, a lot of people will stay with COBRA or they're primarily for their spouses or dependents because they're not eligible for Medicare or other coverage otherwise. And that's fine. Spouses can stay on COBRA even if you drop off because of Medicare. But you having Medicare and COBRA is not usually going to be the best mix. In COBRA rules, there are exceptions, just like with most Medicare scenarios. There are always exceptions to the rules. But COBRA can be really, really confusing because some of those rules and regulations can seem contradictory. And so if you ever find yourself in a COBRA situation, you're always welcome to contact us. We're happy to help walk you through it or at least help you understand how all of that does or does not work best for you. I'll take a real quick pause to see if there are any questions yet. Not seeing any, not hearing any. All right. Retiree coverage. So if you worked for an employer for a significant amount of time, that employer offers health benefits and or a pension when you are ready to retire. It is always worth your while to look at what options are being offered from that employer when you retire, if they're offering health benefits. The downside to that option is that those benefits can look like anything. Employers have the ability to basically customize an insurance package for their retirees in any way they want. And that can look like any number of things. So some employers will take your insurance that you've had while you were working, and when you get Medicare, when you retire, that insurance will simply become secondary to Medicare. The premium doesn't change, the coverage doesn't change. It's not designed to coordinate with Medicare, but it does become secondary and may or may not pay anything that Medicare leaves over. That's how the feds do it. Sometimes an employer will contract with, say, a third-party administrator who will customize some sort of insurance package specifically designed to coordinate with Medicare, or they'll customize something that looks very much like a Medigap or a Medicare Advantage plan, but may have enhanced drug benefits or lower copays, or those kinds of changes to those benefits, and they can do that. Sometimes they'll just hire a third-party brokerage that they want you to go through to purchase a supplement or a Medigap or a Part D or an Advantage plan. And you may get a discount if you go through that brokerage because the employer arranged that for you. Some employers I've seen offered like an annual lump sum dollar amount, like a pot of money, and they allow you to use that to pay premiums to get whatever you want, however you want to get it. So if you want to go out and buy your own supplement or your own Advantage plan, they'll allow you to use that pot of money simply for that instead of creating or offering health benefits to you directly. They'll just give you money to pay for it. And I've seen things that are a combination of any of those things. I'm sure there are situations out there that are none of those things. The bottom line is there's no standard. There's no baseline. Employers are basically allowed to do whatever they want if they're going to offer you health benefits in retirement, specifically when it comes to health benefits that may or may not coordinate with Medicare. So if you have the option of any sort of retirement health benefit through a past employer, it is really, really important to make sure you talk to the Human Resources Department, you ask questions about what they're offering, and it's also a good idea to compare the costs of that coverage. Some employers will offer that benefit for retirees at no cost to the retiree. Some employers will make you pay the whole thing. It really is going to depend on the individual employer. So you really need to understand what's being offered and what the costs are going to be for you and how well it coordinates with Medicare. So things to take into consideration: if the retiree coverage includes a drug benefit, is that drug benefit considered creditable compared to Medicare drug coverage? Employers are required to provide you that letter every year. I get them, everybody gets them, that says whether or not the employer coverage that they are offering you is considered to have a creditable drug benefit as compared to Medicare. You'd also want to compare if you have to pay a premium for a retiree plan. How does that compare to just going out on your own and buying a Medigap or enrolling in a Medicare Advantage plan? I have seen some retiree plans that premiums are much higher than it would cost you to just go out and get your own Medigap, and the benefits are less than what would be covered under a Medigap. If the plan has deductibles, if the plan has copays or coinsurances that would be applied before it paid anything off Medicare. And then ease of use is going to be another biggie. If the retiree benefits are an HMO or something like that, or they want to provide you a customized advantage plan that's an HMO, but you've not been in an HMO before, you'd want to make sure your doctors participate with that because it is still an HMO and you'd still have to stay in network. Even if it's not a network, does your current providers participate in whatever network that insurance provides? And then you want to make sure it does coordinate with Medicare. They will not necessarily always do that automatically. And if they're not going to do that automatically, it becomes a situation where either your doctors have to be willing to bill your secondary insurance, your retiree plan, or you'll have to do it. So I've seen it go in ways that are very, very positive and advantageous for the retirees. And I've seen employer retiree coverage go in the opposite direction to where it's very disadvantages, advantage. I can't even talk anymore today. For the retiree, where it's more expensive, less coverage, and just not the most cost-effective option. So never hesitate to ask questions. We are always happy to help you go over whatever benefits are being offered so that you are able to better understand how that's going to work or not work. And if it's not, looks like it's not going to work to your best advantage, we'll help you look at what other options might be more cost effective. But we need something from the employer that gives us an idea of what exactly it's going to provide to you. We're always happy to talk to people about those options if they have any sort of information like a summary of benefits or anything that would be helpful. We do talk to a lot of retirees, public employees with PERA. We talk to a lot of federal retirees. We talk to a lot of military retirees, and all of those options work differently. So if you are retired military or a veteran, you have different options. If you are retired military, meaning you put in your 20 years or more, and you were honorably discharged from the military. If you're a retired military, when you become eligible for Medicare, whether it's at 65 or otherwise, you have the option of enrolling in TriCare. And that TriCare becomes TriCare for Life automatically when Medicare goes into effect, automatically coordinates with Medicare, and acts very much like a Medicare supplement or Medigap, only better. And it includes creditable drug coverage at no cost. So it is a benefit that was promised to retirees of the military for years and years and years by Congress. It was finally passed into law in, I want to say, 2004. And I spent a whole year convincing retired military people that it was a good thing because they were not entirely comfortable with dropping whatever other coverage they may have currently had at the time and letting the military provide them with insurance to go with their Medicare. But it has worked out beautifully. It is honestly, if you have Medicare and TriCare for Life, you literally have the best coverage available in this country today. There's no, hands down, there's no other question. So it is a benefit that was earned, it was a benefit that was deserved, and it's a benefit that people should take advantage of. Now, if you are retired military and you are working a second career and you continue to be employed with employer coverage, again, you can delay enrollment into Medicare and you can delay enrollment into TRICARE. But if you're not actively employed and you don't take TRICARE, or if you don't enroll in Medicare, so if you're not employed, you don't have other coverage, and you become eligible for Medicare, but you choose not to enroll in Medicare for some reason, that could potentially mean you could lose TRICARE as well. So for retired military, whether you're currently on TRICARE, pre-Medicare or not, TRICARE or the military really wants their retirees to get Medicare and enroll in TRICARE for Life. Now, if you're already on TRICARE pre-Medicare, that will be an automatic process because it's really not an enrollment. It's just a change of status for the coverage that you already have in the military. There's no ID cards. Your military ID becomes your ID card for health benefits because Medicare is primary. And the DEER's offices have become very, very proactive in sending out postcards to people who are getting ready to become Medicare eligible up to 3 months prior to that 65th birthday, and reminding them that that's coming up and telling them what they need to do in order for TRICARE to go into effect at 65. So pretty much they've become pretty good at taking care of all the details for you. You just have to make sure that you are aware of what's going on and do what you got to do. But again, if you're retired military, that is the way to go. Any other kind of option or insurance option, like an Advantage plan or a Medicare supplement, is not needed. You've got between Medicare and TRICARE 100% medical coverage, and it includes a more than creditable drug benefit. You literally don't need anything else. Now, if you choose to enroll in something else, and there are Medicare Advantage plans that are marketed specifically towards retired military people, and the only difference between those Advantage plans and other Advantage plans is it doesn't include drug coverage, because they know that retired military people have drug coverage, is that it limits that person's ability to go where they want to go and see who they want to see. The Advantage plans, again, they come with some bells and whistles. And if the bells and whistles are what someone really, really wants to take advantage of, that's fine. But in exchange for limiting the providers that you can see, the networks you can use, you really got to take those pros and cons into consideration to see if it's worth it. Yes, ma'am. So TRICARE for Life is designed only, it works very much like a Medigap. It's only going to pay if Medicare paid first. And it does not cover things that Medicare does not cover. So it does have its limitations, just like a Medigap. And so, again, that's one of the reasons those Advantage plans are designed and marketed specifically towards the TRICARE population, because it can have those bells and whistles, the dental, the vision, hearing services, etc. But if you're retired military, you're also very likely to be eligible for VA access. And through VA access, you might be able to get those services. May not be as quick, but it may not be any less complicated to get those services through an Advantage plan as it would be through the VA. So a lot of things to consider. You definitely want to look at all the angles if you're retired military before you enroll yourself into something else. So what if you're just a veteran? I do get a lot of vets who become eligible for Medicare, whether on disability or what have you, did not retire out of the military, but currently access the VA medical system as their primary care, as their only health care, which is fine. But they come and ask me, well, do I really need Medicare? I use the VA for everything. Why would I need Medicare? And that's a perfectly legitimate question. We live in a military town. We're surrounded by military bases. We have a lot of military people. But it took us a long time to get a military medical facility in El Paso County. And that is the concern. Medicare is good everywhere. For any reason, any circumstance, Medicare will pay for whatever you need. Whereas the VA will cover your medical needs as related to your military service. And VA facilities are not available everywhere at any time. So that's where Medicare becomes the best benefit, because even if you're not near a military facility or a VA facility, Medicare will always take care of you. Unfortunately, Medicare and the VA do not coordinate with each other. And if one pays for something, the other one won't. There are some, of course, always exceptions to the rules, but they're not going to, VA is not going to act like a supplement to Medicare or vice versa in any way. You're either out in the community using Medicare for whatever you need, or you went to the VA, one or the other. So, and you can have both. Absolutely, you can have both. I have a lot of people who use the VA only for prescription coverage. It requires they see a VA doctor once a year to renew those prescriptions, but that's about it. They use Medicare and maybe a supplement for everything else because they can get into, well, hopefully they can still get into a Medicare doctor sooner than a VA doctor, um, and with less baggage. It's just an easier process to use Medicare than it can be VA sometimes. So there are advantages to having both. Now, if you choose not to enroll in Medicare, and when I say not enroll in Medicare, I'm typically referring to Medicare Part B because most people, again, automatically get Part A because it's no cost. So if they don't enroll in Medicare, that is certainly their choice. They can do that, and they would be allowed to enroll in Medicare during any annual enrollment period, that January 1st through March 31st every year. But VA is not considered creditable health coverage. So they would pay a penalty for not having enrolled in Medicare when they first became eligible. So that is a downside. But, you've got to look at your own specific scenario and what's going to work best for you. Other advantages to accessing the VA system is for long-term care purposes. You can always access the VA nursing facilities or rehab facilities, um, long-term care, housing, that kind of stuff. And they have other programs through the VA that wouldn't otherwise even be covered by Medicaid in some cases. So the access to the long-term services and supports is always a big advantage. So even if you're retired military, not retired military, if you have the ability to be eligible for VA access, whether you feel you need it now or not, it's never a bad idea to register and get in that system just so that you're in the system in case you need it sometime down the road. You don't have to worry about going through that long drawn out process in a time of need. So definitely a lot of advantages if you have that eligibility to access those benefits. Again, they're earned benefits that you have entitlement to. Any questions about any of that? Yes, it's okay. So, because the TRICARE, so you are currently on TRICARE Prime, and it's like a one premium for everybody. Yeah. So she would be able to stay on TRICARE Prime under the same cost, and your TRICARE Prime would automatically convert to TRICARE for Life when Medicare goes into effect. Yep. That's the only change that would happen. And then when she becomes eligible, her TRICARE Prime will also automatically change to TRICARE for Life. And you'll be able to drop that premium altogether because there is no premium for TRICARE for Life. Yep. Yep. All right. Medicaid. So Medicaid is a state program, a state assistance program, and a lot of people get Medicare and Medicaid mixed up. Medicare is a program that we pay into, that we earn, and are automatically eligible for at 65. Medicaid is a needs-based program that varies from state to state. So Medicaid is always going to the eligibility to access Medicaid is primarily always going to be based on finance, your income, and in some cases, your assets. Medicaid is funded by federal and state dollars, but it's potentially run differently state to state. In Colorado, we call our Medicaid program Health First Colorado. That changed just a few years ago. Everybody still just calls it Medicaid. What most people don't realize is there are over 40 different kinds of Medicaid just in Colorado. There are over 40 different Medicaid programs that people could potentially be eligible for. The most common program is what professionals refer to as Magi Medicaid. It's basically the Medicaid expansion from the Affordable Care Act. That meant that more people were able to get on Medicaid and have health coverage. There is no asset test for people who are eligible for Magi Medicaid, only income base. And it's basically for anybody under 65 or not eligible for Medicare. Other Medicaid programs are going to be long-term care Medicaid that helps cover long-term care services, whether that's getting help in the home or paying for a nursing home. There are waiver programs for people who have developmental disabilities, and those kinds of things. There's Medicaid for people who can still work, working adults with disabilities. If you're over 65 and you're low income, but your income is just a little bit too much to get you on another kind of Medicaid, if you work, even part-time, you can be eligible based just on the fact that you're still able to work. There are Medicaid programs specifically for people with Medicare. We've talked about them already, the Medicare savings programs. Even though those programs aren't technically Medicaid, you still have to do a Medicaid application to apply for them. So basically, we call them Medicaid. And again, over 40 programs in Colorado. The number of programs and the types of programs available are going to vary from state to state based on whatever that state feels is appropriate for their population. If you have Medicaid and you have other insurance, try to remember Medicaid is always going to be the payer of last resort. So there are people out there that are Medicare, Medicaid, TriCare. I have a friend that's all three because he's quadriplegic. Medicare is always primary. Medicaid is always last. So even though someone is Medicare and Medicaid and TriCare, Medicaid is always going to be after TriCare because they have the fewest dollars to work with. They're always going to be the payer of last resort. And they're always going to prefer that federal dollars pay first, which makes sense. Again, Medicare savings programs are specifically for people with Medicare. There are financial assistance programs like the OAP, Old Age Pension. I hate saying that title out loud because it's really sounds kind of mean, but the OAP program is actually a cash benefit that usually supplements supplemental security income cash benefit for people who are really, really low income. Long-term care is the most common use for Medicaid and spends the most dollars. And again, that can be long-term care services in the home where home care comes to you to help you stay at home, or it could be if you have to go into an assisted living or nursing home scenario. I think I provided this handout in the first week, but I didn't provide it again in the email because I did provide it in the first week, but this gives you the income and asset limits for most of the programs we've talked about that are Medicaid related. The Medicare Savings Program, Extra Help for Part D, and on the back side is for long-term care. And the last thing we're going to talk about, I told you this would be quick, marketplace coverage. Marketplace, again, is a result of the Affordable Care Act that provided private health insurance for people who were not able to be insured through employment or other means. They didn't qualify for Medicaid. Maybe they're self-employed or have a very small business, whatever have you. The biggest benefit of the Affordable Care Act and the marketplace that was created because of it is that it does not allow these insurance companies to underwrite. So they're not allowed to look at your health history and say no. They have to take everybody, regardless of health, which was a lifesaver for a lot of people. Because prior to this Affordable Care Act going into effect, if you had a pre-existing health issue, you were not eligible for Medicare yet, and you did not have employment that included health benefits, you were left out in the cold because you would not be able to enroll in health insurance because of those pre-existing health issues. So this program was a lifesaver, my mom included. She benefited from this program. Basically, it is private insurance. Most marketplace programs are run by the federal government. Colorado opted to run our own marketplace, and it's called Connect for Health Colorado. I put the websites there, where you can go in and you can shop for all the different insurance options that are available. There are several companies. Each company usually has, at least 2 different levels of coverage. The more you're willing to pay, the better coverage you're going to get. Smaller copays, smaller deductibles, those kinds of things. In that website, you can also apply for any tax credits or premium subsidies that you might be eligible for based on income. What that means is that it would reduce either the monthly premium that you would have to pay for that kind of insurance, or it would reduce your copays at the time of service. And then, of course, they'd have to make that up at tax time. Or it will also screen people for Medicaid. So if you go through that screening process on the website, it's going to ask you what the income is. If they see your income is within Medicaid guidelines, they're going to stop the Connect for Health process and send you over to the Medicaid website right away so that you can apply for Medicaid. If you apply for Medicaid online and are eligible for Magi Medicaid, they'll approve it right then and there. So it's a quick process in that regards. If you're covered under Marketplace for whatever reason and you become eligible for Medicare, you can't have both. You can have one or the other, but Marketplace does not coordinate with Medicare. You're not allowed to have Marketplace and Medicare. And in most cases, even if you don't enroll in Medicare, but you're entitled or get enrolled in Part A, you're not allowed to have Marketplace. Now, if you choose to keep Marketplace, you can do that, but it's not going to coordinate well with Medicare. Any premium subsidies or tax credits go away, so it becomes more expensive to stay on Marketplace. And if you're already on Medicare and someone tries to sell you a Marketplace policy, that's a no-no. That's illegal. They shouldn't be doing that because you really shouldn't have both. Now, if you're someone who did not have enough work history to get free Part A, didn't have enough quarters paid into the Social Security tax system through employment, and to get Part A, you'd have to pay a premium. You can choose not to do that and get Marketplace coverage instead. But that's only because you would have to pay for Part A. You don't get it for free. And in some situations, that can be more cost effective than having to pay for Part A and B. Just depends on what kind of coverage you enroll in. But if you were to enroll in Medicare down the road, say Marketplace gets too expensive and now you decide it's more affordable to do Medicare, Marketplace coverage is not considered creditable, and you would be penalized down the road when you did enroll in Medicare. So again, it's one or the other. If you're on Marketplace, you become eligible for Medicare. You definitely want to stop the Marketplace coverage as soon as Medicare kicks in so that you're not paying for both. If you have Medicare, you can go to the Marketplace website and look at or shop for dental vision plans. Again, Medicare doesn't cover dental and vision, so Medicare doesn't care how you get dental and vision coverage. You can get it in any way, shape, or form available. So the Marketplace does offer just dental insurance or dental and vision insurance packages that you can purchase. And if you have Medicare, you can go on that website and look at those benefits, those options. Most dental vision insurance packages or dental packages, I haven't seen anything that is exceptional. They're all going to be an average of $30 to $40 a month in premium, covers self and family. They're going to have maybe $1,500 to, I think the most I've ever seen is $5,000 annual benefit. And there may be a network of dental providers you have to use. But that's the best I've ever seen for dental coverage these days. And you can find that almost anywhere. I also tell people it never hurts to talk to a dentist. If you have a dentist that you've been going to for years, talk to them. Tell them you have Medicare now. Maybe they'll give you a discount. Tell them, ask them if they have a cash discount if you pay cash up front. Ask them if they have their own internal financing with zero interest sometimes. Dental discount programs that are usually at no cost. Sometimes your dentist participates. That can save you some money. So it never hurts to ask about those kinds of things, because what I have learned is that there are a lot of dentists out there. And when employer plans, there was about a 5 or 6 year period where employer plans stopped offering dental coverage for their employees. Dentists had to become pretty creative. And they have learned to negotiate. They've learned to finance. So you never know what they'll offer if you just ask. And it never hurts to ask. The worst they can do is say no. But it does pay to shop around. It does pay to ask questions. Because the other thing about dental insurance is if you go out and buy a dental policy, many times it's going to have like a 12-month wait period before it'll pay for anything more than a cleaning and an x-ray once a year. So if you need major dental work or something serious comes up, anything you pay for and purchase like that, you may not even be able to access for at least a year before it'll start covering anything significant. So just things to take into consideration. And as with all these offerings, rules and laws can be complex and confusing, and that's why we are here. Excuse me as I choke on my drink. We are always welcome, always happy to talk to you guys about any questions you have, any concerns you have. We'll sit down and help you understand. We'll explain. We'll answer questions. We'll do research if we have to. You're always welcome to reach out to us and see if we can help, and we're always happy to try. And that's all I've got for you. Any questions before I let you guys go for good? I do appreciate everybody. I know it was a lot of information, but that's one of the reasons we started spreading it out over a 4-week period, because I used to try and cram all that information at you at one sitting, and it's a lot. And it seems to get more and more all the time. So we're always here. We're always happy to help. Never hesitate to reach out to us. We're always available for phone appointments, just questions over the phone. Email is always a good option. We're always happy to schedule in-office appointments if that's more appropriate. So don't hesitate to reach out. And because we are part of the Area Agency on Aging, even if you don't have a Medicare question, you're welcome to reach out. If you're looking for some other type of resource, we might be able to help.